I call the front bench of the Liberal Democrat spokesperson, Jess Brown-Fuller.
Thank you, Madam Deputy Speaker. I would like to start by thanking my honourable friend for Wimbledon for securing today's important debate and for all of the members approaching the conversation with the compassion and thoughtfulness that the topic deserves. Examples shared across the House show that hospices are a vital part of our healthcare system. They provide outstanding care for patients approaching the end of their lives, offering dignity, comfort and support to families, and they're often driven by hundreds of volunteers alongside the paid staff. And they will also play a key role in this government's objective to move care from hospital to community. And this debate is very timely when the front pages of the newspapers are reporting today that 500,000 people were left languishing on trolleys in A&E and in corridors in 2024 because there weren't enough beds to admit them. Hospices like the extraordinary St Wilfrid's in my constituency of Chichester are the cornerstone of community care, and I was blown away during my recent visit to the hospice, and I'm not ashamed to admit was brought to tears by the accounts from family members and patients and the staff that I met that day. So I applaud the member for Stoke-on-Trent South for her show of emotion, because it's an emotive topic. St Wilfrid's in my constituency provides comfort and compassion to patients and their families during life's most challenging moments, both directly in the calm and idyllic surroundings of the hospice and also out in the community, providing palliative care for 300 people in the comfort of their own homes. Now, it is their belief that everybody should be afforded a good death, and they strive to make sure that there is beauty in every day for patients and for their loved ones, and yet their service is being crippled by rising costs and a lack of sufficient government support. Those hospices are in the process of setting their upcoming budgets right now, and many are having to make long-term difficult decisions to cut palliative care because they lack a long-term solution to address the growing financial strain. And just like the Honourable Member for North Herefordshire mentioned, it's all well and good being able to say you've got a lovely car park when you haven't got any nurses to park in it. And only 17% of the overall costs of St Wilfrid's Hospice is currently covered by NHS grant funding, well below the minimum requirement across the country. One of the biggest components of hospice costs is the salary of their expert clerical, clinical and other staff. Hospices are trying to match NHS salary increases to ensure that staff can afford to stay with the hospices and to remain competitive. And in addition, they are now burdened with paying the increased national insurance contributions, while direct NHS providers are exempt. For St Wilfrid's, this rise in national insurance contributions will cost an additional £210,000. That is a significant financial burden. Now, while we as Liberal Democrats and hospices alike welcomed the recent capital investment announcement in December 2024, this funding does not address the challenges of day-to-day spend. So there is still a vast gulf between rising expenses and available income. And as the member for Birmingham Erdington said, this funding must be the start, not the end. Hospice UK has warned that around 300 hospice inpatient beds, which is 14% of the total, are currently closed or out of use due to a lack of funding and chronic staff shortages, meaning fewer patients are able to access the end-of-life care that they need at one of the most vulnerable times in their lives. The Honourable Member for Twickenham mentioned the Marie Curie report, as did other members across the House, that stated that 1 in 4 who need hospice care cannot currently get it. Now, Madam Deputy Speaker, the term bed blocking is not one I'm particularly comfortable with, but if adequate palliative care is unavailable in the community or in a hospice, then those people remain stuck in hospital, and those hospitals cannot provide the care, the expert care that a hospice can. Our hospices are ready and willing to take on those patients, but need the support of this government to do so. And as the Honourable Member for Wimbledon, who brought forward this debate, said, people do not want to die in hospital. They want to die at home, or they want to die in a specialised setting like a hospice. Now, this is why the Liberal Democrats are calling for hospices to be exempted from the rise in national insurance contributions. This targeted measure would provide immediate relief for a sector that is struggling under the weight of rising costs and prevent further reductions in capacity or even closures. We must think long-term. Hospices need a sustainable funding model that guarantees they can continue their vital work, providing care for patients, supporting families and easing the pressure on the NHS. Hospices must also be a part of the conversation in the government's upcoming 10-year plan for the NHS, and that must include sustainable hospice funding reform. Examples from across the House today showed a shared recognition of the importance of hospice care. Now we need the government to match that recognition for action, for the patients, for the families, and for a health service that depends on hospices. Thank you.